Glad to have you on board, Todd. Any concerns so far?
No, not really. Oh, but the nurse call system isn't familiar.
Oh, it's new. We put this in as part of restructuring the ward. It's helping us strengthen our workflow.
Really?
Actually, it's more of an advanced patient response system.
How do you mean?
Well, you know, response time is everything. When a patient calls us for help, it's our #1 priority. In a typical call-light system, you would hear a signal, check the nurse's station, find out where the signal comes from, go to the room, find out the patient's needs. This one does so much more.
Nurse Shelley here, how can I help?
Yes, I'd like some water, please.
We'll get you some water right away, Mr. Tammer. Anything else we can get you?
Oh, and a blanket would be nice, if possible.
And a blanket. On its way, Mr. Tammer.
Now, that call just became a logged task, and a nurse's aide will respond to it. Now let's picture quite a different scenario. If no one is at the nurse station, the call is rerouted. In this case, to a nurse's aide.
Karen speaking, how can I help?
Something's happened. Sean's in really bad pain.
Be right there.
The aide makes her presence known when entering,
Sean?
but then recognizes a serious situation. A second push on the bedside handset changes the call to a staff emergency, and multiple staff are immediately notified. The system is patient-centric. This helps us give the right care to the right patient at the right time, and there's more to it than that. Almost everyone and everything here at the hospital, even third-party devices, can be integrated with the system. Or take a device like this. It's been configured to a specific workflow task. You can assign almost anything to one of those buttons.
All right, Mrs. Johnson, time for physical therapy.
Okay.
Someone will be here in just a minute to bring you over there.
Okay, thank you.
Pressing that button sends a notice to transport Mrs. Johnson from room 302.
Wow. In my previous unit, we used to have an issue with pressure ulcers. Automated tasks like this would have made a huge difference.
Oh, Todd, check this out. The system documents every single event and request. You can imagine how much those statistics help us as we work to improve our workflow and throughput.
Throughput?
Remember to drop us a postcard, Mr. Pierce.
I will.
Bye-bye.
Okay. An automated task.
Ah, look, there's Kevin, our CTO. I'll introduce you. Kevin, this is Todd, our new nurse manager.
Hi.
Pleasure to meet you.
We've been talking about the new patient response system.
Ah, Telligence. I'm late for a meeting just now, but you and I will talk about Telligence later, okay?
Great.
Right.
Ascom Telligence lets caregivers know exactly what patients want, saves steps for nurses, and frees up time for meaningful face-to-face care. Ascom Telligence, keeping care close at hand.